of the adrenal cortex that occurs when the body produces or experiences high levels of cortisol. It's a disease of the endocrine system. So, just to give you a little background of the endocrine system, its main function is to secrete hormones. So, it regulates metabolism, growth and development, tissue function, and sexual function. Essentially, the endocrine system removes materials from the blood. They process them and then they secrete chemical products to the needed area of the body. So, just a key tip, if the hormones are too high or too low, that indicates a disease of the endocrine system. Other factors that can cause disease are stress, electrolyte imbalance, and the body's response to hormones. So, these are just some terms that you need to understand. So, the adrenal cortex, it's located on top of the kidneys. It releases your aldosterone and cortisol. The aldosterone regulates blood pressure through renin-angioaldosterone system, secretes potassium and retains sodium. Your cortisol is your stress hormone. It increases blood glucose, breaks down fats, carbs, and regulates electrolytes. And then this is the process of how cortisol is released. So basically, the hypothalamus located in the brain, it releases what's called a corticotrophin releasing hormone, or a CRH, and it tells the pituitary gland to release your ACTH. So that's called the corticotrophic hormone. Once the pituitary gland releases that, it stimulates the adrenal cortex to secrete steroids. So the three S's, it's easier to remember it that way: sugar, salt, and sex, or cortisol, aldosterone, androgens. So basically, when you have too much of these, like sugar, salt, sex, you can have high blood pressure, you can have high glucose levels, and you also get excessive. So androgens means excessive hair growth. So once that happens, the adrenal cortex releases cortisol. But this process is a positive feedback. This is what the body naturally does. So getting into the pathology of Cushing syndrome, basically cortisol, once it's released from the adrenal cortex, the cortisol is flowing through the blood. So cortisol basically tells the pituitary gland to stop or suppress. It kind of inhibits the production of the ACTH, and then it does the same thing to the hypothalamus. So it's both suppressing the ACTH and the CRH from the hypothalamus, and it inhibits the immune system. So most of these patients would have infections, low white blood cell counts. You would see osteoporosis because it's inhibiting the bone formation, type 2 diabetes because of high glucose levels. And I wouldn't really say increases metabolism, so I don't know why I put that. It kind of does, but you see a lot of weight gain here because of the irregularity of the metabolism. And now Michaela is going to talk about the signs and symptoms and everything.
Yeah, the weight gain, actually, that's from the sodium and water retention,
Yeah.
mostly. Yeah.
I want to say
Yeah.
increased metabolism only because fast metabolism, you think your
Lose,
metabolism
lo-
fast, you lose weight, right?
lose weight, yeah. Yeah,
Yes.
it's from the weight gain in patients with Cushing syndrome. It's due to the retention of sodium and water. That's why. Mhm.
Michaela.
Okay, so the clinical manifestations, hyperkalemia, hypertension, vascular disease, kidney disease, and neuromuscular manifestations. So people with Cushing syndromes, they are at risk for cardiovascular disease, osteoporosis, like Jeanne said, frequent infections and loss of muscle mass and strength. You can go to the next slide.
Oh yeah, I'm so sorry. I forgot I was doing that.
So the signs and symptoms, emotional instability, like they do have an increased level of cortisol hormones, so they're normally stressed. Slow wound healing, and that could also contribute to the high glucose levels. Risk for fractures from brittle bones, and the striae of the skin. If you look at the photo over here that says Cushing syndrome, it's those indentations or marks that you see within the skin, and a truncal obesity. So abdominal obesity, also they have like the round abdominal protrusion, and hyperplasia, moon face is actually a key factor. You can see this woman over here. She has a round face. And also enlarged supravascular fat pads, they call it buffalo humps. Usually around the supravascular sides, it's a hump that they usually see. In hirsutism, they're normally very hairy. And high blood pressure, sugar, and weight. So with the labs, they do three type of labs: late night salivary cortisol. Um, it's a saliva sample that can be collected late at night in the person's home, and they can take it and be tested. Usually, they suggest that it's collected at least 3 nights in a row. Then they have the 24-hour cortisol test. If it's a regular once, they usually run one more test. And then they also have the dexamethasone suppression screen testing. So that is dexamethasone is a synthetic steroid that mimics cortisol in the feedback inhibition of corticotropin. So it involves them giving like one dose of 1 milligrams at bedtime, and then they just see if the levels have risen or not. Usually, someone who has Cushing syndrome, the levels will not decrease. So that's how they test for it. And other labs ran, you'll usually see like increased urinary potassium levels, ACTH increased, sodium elevated, and also metabolic alkalosis. But another important fact, cortisol is really important to Cushing syndrome. And during those labs, they see a normal range of 5 to 25. But if someone who has Cushing syndrome, the level would be more than 50 to 100.
Can I just interject, Janae? You mentioned in one of the previous slides that the patient with Cushing syndrome, they exhibit or they are manifested with under the clinical manifestations of Cushing, it said hyperkalemia. So I'm not sure that, that's, you got it from the book.
Yeah, I did.
It should be hyperatremia, right?
Yeah,
Hypomagnesemia.
with the sodium, it is retention, hypernatremia, but for potassium, it's hypokalemia. And it's most of the time, it's, even under Cushing syndrome and pathophysiology, mid-surge textbooks, it says unexplained hypokalemia. There is some theories behind it, but why would patient with Cushing syndrome develop hypokalemia? There is one explanation. I will go over that when we do the endocrine system and the Cushing syndrome. But patients with Cushing syndrome, they develop hypokalemia. And this slide explains why the patient in blood potassium in the blood will drop, because you see here increased urinary potassium levels.
Okay.
That's at least one thing to connect the hypokalemia, which is low blood level of potassium blood level, and the excretion of potassium in the urine. Does it make sense?
Yes.
Yeah. So hypernatremia, fluid overload with sodium, and then potassium will be low in the blood in patients with Cushing syndrome. Go ahead.
So for treatment, they want to have management of the hypertension, medication with aldosterone receptor antagonists, and so it would be surgical if aldosterone is secreting adenoma is present. So without approximately 50% of individuals with Cushing syndromes die within 5 years of onset as a result of overwhelming infection, suicide, complications from generalized arteriosclerosis, and hypertensive disease.
So this slide also proves what we're trying to say, right?
Yeah, with the hypokalemia.
Yeah. Okay.
Mhm.
Good. Perfect.
So we just put like 2 questions to test your knowledge. I don't know who wants to participate, but if you do, just, shoot out the answer. Which of the following is not a typical sign and symptom of Cushing syndrome?
A?
Yeah, it's A. So truncal obesity, purplish striae, and moon face are 3 out of the many symptoms of Cushing syndrome. Michaela, you can do this one.
With Cushing syndrome, a nurse would find it normal to see her patient with, I don't know if anyone wants to participate.
It's D.
Yes,
Yeah.
yeah, it is.
And that concludes our presentation. So I'm going to stop sharing.
All right, perfect. Thank you very much. Excellent. Yeah, excellent.